Hey, everybody, welcome to the Aligned Love Podcast. This is the place where I am going to help you find the one thing that you feel is missing: healthy love. I am your host, Lauren Zoeller, and in this podcast, I will share with you how to attract love, live in alignment, and elevate your deepest relationships. So buckle up, get present, tune into your body, and open up to the possibility that you truly do get to have it all. Let's dive in. Nicole, welcome to the show.
Thank you. Thanks for having me, Lauren.
Yeah, I'm so excited. We're going to be talking about a really spicy topic today that I'm excited to chat about because I know there are a lot of women that follow me. I have a lot of single women, but I have a lot of single women who are venturing into the world of creating babies on their own, becoming single moms, freezing their eggs, going through this entire hormonal journey to be able to create life and bring life into the world. And I know that you are an expert at really managing your health and getting yourself back postpartum and managing mental health in that space too. So before we even dive into that, because I'm really excited to talk about it, I always like to start the Align Love podcast with an intention setting. So I would love, if you can, if you could set an intention for us for what we're going to walk away with as a result of our convo today.
I love that. Well, the intention is to put yourself first and take care of yourself first, because you can't serve from an empty vessel.
I love it so much, which really does bleed into everything that we're going to chat about as far as being in the space of taking care of yourself postpartum mentally. So how did you even get into, I'm sure there's a full journey as to how, I'm sure you had a postpartum journey. Nobody just decides to go into this field.
Right.
Can you tell us a little bit about that journey of how you started to navigate into postpartum mental health and really supporting women in that way?
Yeah, absolutely. So, like most journeys, it was not linear. And so I spent most of my academic career working in academic medical centers, building a program of research around caregivers with patients with advanced medical issues like cancer. I felt that I had my research career trajectory set out, and I was working with patients and really loving it. And then, the simple story is that personally, I became a mother around that time. And it dawned on me that, when we think of caregivers, they're known as being a silent patient because they're so focused on the patient's needs, and everyone's on the medical team is focused around getting the patient better. And so I realized that mothers are actually the silent patient, and we really could do a much better job in preparing mothers for their journey in motherhood, but also postpartum, because they suffer from anxiety and depression. We have a maternal mental health crisis. And I walk the walk. So I'm a clinical psychologist. I'm an expert in treating mental health and postpartum. And I actually went through postpartum twice. And even though I was an expert in caregiver research and clinical work and teaching others to take the best care that they can of themselves, I was not immune. So my mission is to break the stigma of mental health treatment. It can happen to anyone. I have trained at the nation's top institutions, and I was still, subjected to postpartum twice. But I went from rock bottom to thriving fairly quickly because I sort of followed my own advice and the treatment guidelines that I recommend. And I really just want that for all mothers.
Yeah. Well, and it brings up an interesting point to me, because I know I personally don't have any children, but I have a lot of friends who have had children who I have been on the other side of being their support system.
Yeah.
And it's interesting to me, and I'm curious to know your thoughts on it. I think it's a pandemic that so many women have children, and it's almost as if they're in denial that there's something. It's like society has conditioned us to have a baby, and then you just have to be the best mom in the world. And you don't have to deal with any of the repercussions of the hormonal changes and the fact that you have this new tiny human that you have to take care of, and you still have a husband or a significant other that you have to manage. Or if you're a single mom, you still have to work and go back into the world. So the first thing that I want to do is I want to let everybody know that's listening, like postpartum is real. And I'm sure you have something that you want to say about this. There's no shame in saying I am struggling
Mhm.
in the space of having postpartum
Yeah.
issues. But also, I want us to normalize what are the symptoms and
Mhm.
how can someone really know that they're in distress
Yeah.
in
It's a
this
good
in the postpartum space.
Yeah, I mean, there's so much to unpack there, honestly. I mean, I think that our society does have this image of the perfect mother, and social media doesn't really help, right? We see these filtered images of what it's supposed to be like. And there's this message that when we become a mother, everything's natural and we'll just, adapt and things will come naturally, like breastfeeding and tending to a baby 24/7 and figuring it out. And really, what we know is that maternal instinct is a myth, and it's all about really trial and error. And the numbers are staggering. So if you're feeling off or you're feeling anxious or depressed, you're probably more like your peers than you think, because
Mm,
1 in 5 mothers experience postpartum mental illness. And the thing is that we think that that's an underestimate, right? Because mothers are still afraid of reporting their symptoms for fear that they'll be viewed as unfit. So I love how you asked me if there's a list of symptoms that mothers can sort of take away from this. And my mission is actually to encourage mothers that if they feel off in any way,
mm,
to meet with an objective professional that can do the diagnosis and assess you. Take that off your plate. You don't need one more thing to do. I am the checklists help to an extent, but
yeah.
sometimes we're not capturing enough mothers because it doesn't really get at what's really going on. So if you're feeling like something's off, go speak to someone. And I even advocate for setting up a postpartum mental health team proactively,
Mm,
because that way you're not scrambling last minute to find a doctor or to wait 3 months for an appointment, right? You figure out who you want to work with and you have that set up should you need it.
yeah.
You may not, and that's great if you don't. But even if you're not suffering from like clinically significant symptoms of postpartum depression or anxiety, it still may help to have an objective thought partner where you can bounce things off of and talk about the adjustment to motherhood, because it is we know now it's a developmental phase, like adolescence. So why not treat it the way we would with adolescence, right? We nurture
Right.
that developmental stage. We have resources. We know it's like, an intense hormonal storm, right? The same is true for matrescence. That's what it's called. And so why not set yourself up with support just in case you need it? I mean, you just don't need one more thing to do.
Right. Right. It's funny to me because we preach so much about having support when we're in other transitions in our life.
Mhm.
But it's staggering to me how many women don't look at this like a massive transition. I mean, you're bringing a child into the world, you're completely changing the landscape of how you've operated in a day-to-day basis. It would make so much sense to make sure that you have the support to be able to, even if, again, like you said, you don't feel like you're suffering from postpartum depression or anxiety,
Mhm.
there's still this massive life transition
Yeah.
that you're having to navigate, which it's so important to have that support. I know I have a woman on my team who she struggled for a long time. She had a baby and afterwards she just couldn't get back to herself. And it took months. I want to say the baby was almost 2 years old before she decided, you know what? I really think I need to be medicated to get through this so that I can start to actually do what I need to do to get myself back.
Yeah.
And that was such a liberating moment for her too, because there was so much stigma around, I don't want to take a medication and this isn't the right thing to do. And so what I really love about this conversation is that it's giving women permission
Mhm.
to, you just said it. If something feels off, go talk to somebody.
Yeah, absolutely. And talk to someone that specializes in postpartum, because there are a lot of well-intentioned medical providers that don't necessarily know what they're looking at. And so patients get dismissed, mothers get dismissed all the time, not because the provider doesn't want to help them, but because they'll give feedback like, oh, this is just a normal part of motherhood. It's supposed to be like this. Well, if you have someone that specializes in postpartum, you're going to get a more nuanced idea and feedback about what's going on. And it may not be, because a lot of women come to me after they've seen several providers where it's gone undiagnosed. So that's really important.
Yeah. Yeah. So I'm curious to know during this entire phase, postpartum and getting everything back in order, how does someone prioritize themselves while also prioritizing having a baby and maybe even a husband or a partner that they're also having to support? I mean, what type of advice or guidelines do you give to someone who wants to say, okay, I've got to take care of myself again, but I'm terrified that it's going to reflect onto the baby or to my partner?
Yeah. I mean, I'm so glad you asked. I think a lot of women and mothers are asking themselves the same thing. And so that's why I wrote the book Rattle. It literally lays out a roadmap to all of those things, because everything changes. And you said before, that your coworker was like, I just want to get back to myself. Well, I educate my patients and women that I talk to about really just saying goodbye to that pre baby person, because everything changes. Your brain changes, your hormones change, your body changes, your relationships change, your marriage changes. And that's not a negative thing, but we do need to validate how seismic these changes are. And so you're going through this transition and you're going to come out the other side a different person, and hopefully a better version of yourself. I do see becoming a mother as an opportunity for profound development. And so with Rattled, I have each chapter dedicated to things like how to take care of your marriage, how to prioritize your own mental health, how to think about baby bonding and the transition, your identity changes and becoming a mother. Postpartum is part of it, but it's not all of it. I mean, it's a huge transition that affects every system in your life and your body. So I really think that, changing the perspective of this is an opportunity to invest time into yourself. And the better you take care of yourself, the better you'll be able to take care of your baby and your partner, right? And the family, right?
Mm-hmm.
So,
Yeah. Yeah. Well, you're normalizing that this is, and again, it goes full circle back to what we were talking about at the beginning, that so many people think that they're supposed to just like churn and burn out babies. And then they're just supposed to go back to who they were before that baby was in the world. And the truth is, everything changes. Everything changes. And so many women have such a hard time with that because, I mean, your sex life changes. The
yeah.
way that you go on dates changes. The way that you show up at work changes. I mean, everything in your life shifts once you have a baby. And the fact that we're not talking about pre and post care of all of that, I think it's a huge issue. So you are filling such a massive gap.
Yes.
Space that I feel women really, it's like, this should be normal. This should be normal conversations that women are having, and it's not happening.
I agree. I mean, before I became a mother, there were no discussions about what that would be like. It was all like, oh, here's the baby product that you need, or here is how you're going to set up the nursery. And here's like the after, you give birth, the plan around sleep scheduling and feeding and all of that. And I had no idea until I became a mother of all of the things that change, and what a missed opportunity it is when we don't have these really important discussions. And you're very well versed. I would say, are you sure you don't have a kid? Because you get it. You get it.
Yeah. Yeah. Well, I feel like I have children, right? Because so many of my friends I was there for the entire process afterwards and supporting. I'm in mental health too, but there's something to experience, I think personally, someone who's going through that and to be able to witness it. And so many of my friends have gone through it that I have recognized, even just in having discussions with them, like, I wish I could have just handed them your book, like, hey, read this because this is going to help you, and read it before the baby gets here.
Yeah.
Read it the moment that you are pregnant and you know that you're going to be making this massive transition in 10 months. And so I think, I don't know, I'm just really passionate about the work that you're doing because women need it. And we need to start normalizing this conversation.
I agree. I mean, I say once you pee on that stick,
Yep.
set up your postpartum mental health care plan, read Rattled, right?
Yes.
Get in the mindset of honoring and validating what a huge transformation this is for you. And in its own right, it's not even so that you'll be able to take care of your loved ones better because you'll just have more in the tank and more to give, right? In your own right, this is your opportunity for yourself, right?
Yeah.
To dig deep, to root down, to discover how resilient you are, how powerful you are, and to work with all of these changes. And I talk a lot about neuroplasticity in the book in terms of your brain making these prolific developments, and neural networks are forming around taking care of the baby and becoming a mother. And it's an opportunity to really nurture those changes because when they go right, they're brilliant and they're incredible. But so many times they can go wrong because we have a postpartum mental health crisis, or we have birth trauma, or we have the expectations that were not met, or the disappointments, or the shadow losses. I mean, there's just so much that goes on. And I think mothers are just used to swimming upstream, and we really need to help them.
Yeah. Well, and in turn, what people don't understand is that it's going to affect your ability to be the mother that you truly want to be and the wife that you truly want to be. It's going to affect the way you show up. So even though we're making these decisions because we feel this need of, I need to be strong, I need to have this figured out, it's not just hurting you, it's hurting everyone that's affected by you being in their life. And so I think even starting to shift the lens to, hey, this is for everybody. It's for everybody that you read this book because we all need you in the best version of yourself. Postpartum is just, it's really important. So, Nicole, where can people get your book? Take a moment to kind of let everyone know where they can purchase it and also where they can follow you.
Yes, so definitely follow me on Instagram at Dr. Nicole Pensek. I update, everything about the book there as well. And then you can get the book wherever books are sold. So, Amazon, any major bookstores, support your local bookstores. So yeah, and if you do end up reading it, please, let me know what you think and leave a review. That really helps. And the book is for fathers too. And I also I'm getting a lot of feedback from mothers in different generations, right? Who have have teenagers or, even older. And they're saying, wow, it's really helpful for them to understand what they went through, right? Because at the time they weren't really allowed to have postpartum or discuss it. It was taboo. It was, not assessed at all. And so, it's very validating for them as well.
I love it so much. And we'll make sure that we drop all of the links to Nicole's book and your socials and everything that you give us. We'll drop those in the show notes below. So Nicole, and I can't wait to read the book. I feel like I'm ready. I'm starting to make my way into finally being ready to have babies. So it's going to be, I'll read it way before I get pregnant. So I'm excited for that. But I ask one final question on the Align Love podcast every single time. And I'd love to hear people's answer to it because it's different. What does an aligned relationship mean to you? And it can be a relationship to yourself, a relationship to your baby. What does it mean to be in alignment?
I love that question. For me, I feel most aligned when I'm in my wise mind and I'm able to be present and connect with the other person in a genuine way that's honest for both of us.
Yeah. So good. Yeah. Well, and that comes full circle to everything that we've been talking about today.
Right. So how to manage your own emotions and understand, how your own dynamics play in and where you need to work on something that's separate versus what's happening in the room with your children and your spouse, right? Because it's so intense and stressful at times that it really can bring up so much stuff.
Yes.
And so, yeah, it's helpful to be aware.
I love it. I love it. Nicole, thank you so much for coming and speaking about this topic. Again, this is something that women need to hear. It is such a vital topic that obviously I'm very passionate about. So thank you so much for showing up and sharing your heart. And I'm going to have you on the podcast again soon. And if you are listening right now, make sure that you take a moment to check out the show notes below and grab Nicole's book. Nicole, thank you so much. We'll see you again.
Thanks for having me, Lauren. Great discussion.
Yeah. That wraps up today's episode of the Aligned Love podcast. One thing that would really help me and the other new potential listeners is for you to rate this show and leave a comment wherever you tune in and listen. Also, make sure to link up with me on Instagram at Lauren Zoeller, and please share this podcast with anyone who you think may enjoy it. Until next episode, remember, every transformation begins with one moment of awareness, and I hope today has been yours. I'll see you next time.